Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended with a blocked right ear. And this is a keratin plug, so it's not your typical earwax. Instead, it's an accumulation of really dry, dead, crusted skin that's formed into a plug. It's not quite keratosis obturans. So with keratosis obturans, the hallmark symptom is otalgia, so ear pain, which this patient didn't exhibit. And quite often with keratosis obturans, you get a remodeling, a reshaping of the bony osseous part of the ear canal, so the inner 2/3. And this patient didn't have that. So for anyone who's not sure what a keratosis obturans is, I have got a playlist on my YouTube channel. So feel free to visit and select the playlist. And I talk and discuss about what a keratosis obturans is in quite a lot of depth actually, and there's quite a few videos there. And I've just put some oil in the ear, some medical grade olive oil, to try and loosen this plug of skin. And initially I used a right ear hook to try and extract it, but it just dissected through the core instead of removing the plug from the ear. And this patient did get some water in the ear, and what you'll find is that once I remove this outer plug of dead skin, there's a more medial plug which is quite soft and damp, and it's all macerated. So the skin that lines the ear canal is made up of epithelial skin cells, and the outermost layer of these epithelial skin cells is just actually dead skin full of keratin, but this outermost layer of this epithelial skin is hydrophilic, so it's water absorbing and water loving. And because this patient got water into their ear, the epithelial skin has absorbed this excess water, and it's caused the skin cells to overhydrate themselves and eventually burst at the membranes, and it's led to the breaking down and the maceration of skin. And you will see that in a moment. So what we've advised this patient is to use some over-the-counter acetic acid spray for the ear. And the reason for that is that our ears should be at least mildly acidic, and when it's mildly acidic, it inhibits the growth of harmful pathogenic bacteria. Now, our ears are actually full of bacteria and fungi, but they're harmless under normal conditions. And when I say normal conditions, our ears should be dry and they should be mildly acidic. And they shouldn't be too warm, so they shouldn't be, so if you've got a lot of humidity and you're in a hot country, for example, if the ear temperature is raised, under any of these conditions, it then allows the colonization of harmful bacteria, and the fungi that's usually harmless in the ear can then become pathogenic. So when you get water in the ear, number one, it's increasing humidity, moisture levels in the ear, and typically water is more neutral or even alkaline in some conditions. At least in the UK, I don't know what the water pH level is across the world, because there is differences there. And by introducing more neutral water in the ear, it's going to increase the pH level, and by increasing the pH level, it then allows the opportunity for more harmful pathogenic bacteria, which are neutrophilic, so they thrive under neutral pH levels, so they can colonize the ear, exponentially grow, and then possibly lead to an ear infection. So by using some acetic acid spray, which is essentially white vinegar, we're going to re-acidify this patient's ear to reduce the alkalinity, to turn the pH into a more acidic pH, and to hopefully prevent a secondary infection, otitis externa, developing in the outer ear. So just a bit of skin left around the edge. I'm going to try and remove as much as I can, but we did get some clarinetting a bit later on, so I stopped. But you can just see this epidermis layer of skin, it's all broken down, it's damp, it's wet. And because they had all this wax and, dead skin in the ear, it kind of waterlogged the water behind the plug of dead skin. Now, I'm not a big fan of water in the ear anyway, and I know many of you may be watching this video and have never had any problems with water in your ear, and that's in terms of probability, that's not going to be the case. So if you have 100 patients, for example, who all get water in their ear, the majority of patients will be fine. The water may drain out, or they've got a good immune system, so it's going to prevent harmful bacteria from causing an infection, but 5% at least will then develop otitis externa, and we call it swimmer's ear, so an infection due to water getting into the ear. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.